Hi, darlings. The Kabiola here. Welcome to my channel. If you're a returning subscriber, thank you so much for staying tuned. Thank you. How are you all doing, aspiring international nurses? So today we'll be discussing the identity checks that you should do when you go for your OSCE examinations. And we have two types of identity checks: the hospital setting identity checks and the community setting identity checks. So those are the things we'll be looking into today. So tag along. Welcome. So when we talk about identity checks, it's just you trying to cross-check that you're with the right patient. So when you're being given a scenario and you've read through your scenario, you've approached the patient, you want to confirm the details of that patient to ensure that it's the same thing with the document you have with your scenario. Now that we're talking about OSCE, so you just want to confirm that you're with the right patient, you're doing the procedure, you're giving the information to the right person. And when we talk about identity checks in OSCE, we have two types. We have the hospital setting identity checks, and we also have the community setting identity checks. So for the hospital setting identity check, I like to call it the three key identity checks. And then for the community settings identity check, I like to call it the two keys identity check. Reason is, for the hospital settings, you're trying to check the patient's details against three things. And for the community settings, you're trying to check the patient details against two things, which we'll dive in. Now, for the hospital checks, like I said earlier, three key ID check. What are you checking against? You're checking verbally, you're checking the IDs verbally, you're checking against the wristband and against the documentation that you have with you. Now, when you're approaching the patient, you know that you're going to read the patient's details. The patient's name is going to be in the document that you'll be giving to. That's your scenario. Now, when you approach the patient, the first thing you want to do is to check the patient's ID verbally. So, for example, you approach a patient, you've done your 7 steps of nursing. Now you approach your patient, you want to confirm your patient's name, and then you go ahead to ask, please, can you kindly confirm your name for me? And then, for example, the patient will be like, oh, my name is Brown Lima. You're going to check the patient's wrists to check the ID band, the wristband the patient has on, to be sure that the name written on it is Brown Lima. You also now check your own document. That's the third one. You check your document to see that the name is still the same thing that the patient is telling you, oh, Miss Brown Lima. So first is verbally, you asking the patient telling you. Second is against the ID band. And thirdly is against the documents that you have with you. That's your scenario. Now, what are you asking the patient? That's another thing. So we know the three things that we need to check a patient's ID against when we talk about the hospital settings ID checks. Verbally, you're asking the patient ID band, which will be on the patient's wrist, and then your own documents. That's the scenario you're being given. Now, what are the things that you need to ask the patient? Firstly, you're going to ask the patient's name. You confirm it with a wristband, and then you confirm it with a document you have with you. Secondly, you want to ask the patient what their date of birth is. You just kindly tell them in a very respectful manner to please confirm their date of birth, which they will do. When they tell you the date of birth, you check the ID band to be sure it's the same thing as the patient has stated. And then you also check your documents to see that what is written in your documents, that's the scenario you're having with you, is the same thing. The next thing you want to check is the NHS number. But most times, people don't know the NHS number because it's quite lengthy. Patients might not really know the NHS number. So when you tell the patient, oh, please, I'd like to know your NHS number, you just go and check the wristband. That's the ID band, the hospital ID band the patient has on them. You just check the band and then you confirm it. As you're checking, you're confirming the documents too. So you just be like, I'm just going to check your ID band. I hope you don't mind. Patient to tell you to go ahead. So you now check your NHS number is 30604. You check 30604 298. You check on the wristband. You check on your own document to be sure you have the same thing. Now, when that's done, you need to ask about allergies too. I believe I've mentioned in one of my videos, when you do your identity checks, please ask about allergens. Now, you want to ask the patient if the patient has any allergens. When you ask your patient if they have any allergens, oh, please, can you confirm if you have any allergens, please? Are you allergic to anything you'd like to tell us? The patient might tell you, yes. For example, I'm allergic to ibuprofen. For example, I'm allergic to peanut. When the patients tell you that, there's usually another band, there's another tag that the patient is supposed to have on, which is specifically for allergens. So you have to check when the patient say that, that's the patient has said it verbally. Now you have to check the patient's wrist to see if it's actually there. Sometimes there's another wristband specifically for allergens, and sometimes they might actually just put it together. Now, when you're done doing that, you ask the patient has told you he or she is allergic to what they tell you they are allergic to. Now, the next thing you want to do is to check the wristband. After checking the wristband, you want to confirm from your scenario, from the documents you have with you, to be sure that what the patient has said they are allergic to, of course, they have that allergy. Now, you go ahead, you go further to ask the patient, you're allergic to ibuprofen, what are the associated effects? Please don't just ask about allergens and just leave it there. No, you want to ask about the associated effects. Oh, you're allergic to ibuprofen. Oh, thank you for letting me know. Please, can you kindly tell me what the associated effects are? And then the patient will tell you, oh, I get rash, oh, anaphylaxis. Do you understand? So about the hospital ID checks. That's it basically about the hospital ID checks. Now, when we talk about the community settings ID check, like I said earlier, it's a two key ID checks. What are you asking? What are you checking? You're checking verbally from what the patient will tell you, and also your own documents. That's the scenario that you're being given. Why? Because the patient is not in the hospital, so they do not have the wristband. It's that simple, it's that easy. Although what you're looking for in the community settings ID check is different from what you'll be looking for, slightly different from what you'll be looking for in a patient who is in the hospital. So now when you're doing an ID check for a patient who is in the community, you want to ask verbally from the patient, and then you want to check your own documentation. That's the scenario. So when you go to your patient, when you approach your patient who is in the community now, and you ask them to kindly confirm their name for you, they told you their name. Please, can you kindly confirm your name for me, please? Oh, the patient tells you, my name is Brown Lima. Chuket, my name is Brown Lima. Now, the patient is not in the hospital. You're not checking any wrist because the NHS band or the ID won't be on the patient's wrist because this patient is in the community. The next thing you want to do is to confirm your own documentation. You want to check your scenario. Oh, Brown Lima, I'm just going to check Brown Lima, the same name as the patient has stated. The next thing you want to do is to ask of the patient's date of birth. Please, can you tell me your date of birth, please? Date of birth is you check your own documentation. It is correct. That's fine. Now, the next thing you want to do that you don't get to do in the hospital, you now ask the patient, please, can you kindly tell me the name of your GP? Please don't forget, ask the patient what is the name of your GP. Ask in a very polite manner, ask in a kind way. And then the patient will now tell you the name of the GP would actually be on the document you're on. I think most times, even with the GP's phone number, but you don't need to ask the patient about the phone number. Just ask about the GP's name and you confirm it with the documents that you have with you. So another thing that you can also do is to confirm the patient's home address because you're going to have that in your scenario. It's going to be in your documentation. So you might just want to ask the patient, do you mind confirming your home address for me? And then you just cross check. Reason is because it is a community setting. This patient is not in the hospital. You just want to try and check by all means to be sure you're with the right patient. So that's it basically. Mind you, when you ask about the names, ensure you're getting the full name from the patient. Don't just take the first name or the last name and leave it like that because on your own document in your scenario, you definitely have the full name on there. So you want to get the full name from the patient. So even if a patient has stated to you that my name is Brown Ward, can you confirm your full name for me, please? And that's it about the identity checks, either for hospital settings or for a community-based settings. And please do not forget to ask about allergens when you do your ID checks. It is very important. The reason why I usually emphasize on it is because most people just leave it, hoping that during the conversation with the patient, they will get to ask. but most times people don't remember to ask. So please always remember to ask when you do your identity check. Ask about the patient's allergen. And guys, that's it basically about you doing your identity checks for your patients. We've come to the end of this class. I hope you're able to pick one or two things. I hope you're able to learn something from this class. And yes, I wish you all the best in your OSCE. And I'll see you in my next video. Cheers.